Hi, everyone. Ron Crider reporting for duty today, as I do every day. It's December the 22nd with this broadcast, and I'm with Dr. Kevin Kavanagh. What is the significance of the UK mutation of this virus? What's going on over there? How bad is it? Will these vaccines that we have work?
It is very much a concern, but at this point, I would not panic. This virus is an RNA virus. It has had many, many mutations to date. We've seen mutations. Well, the initial virus in the Northeast was the D614G variant, and it was more infectious and it spread more rapidly than the original Wuhan virus. And that's what devastated Northeastern United States. So we've seen this before. We've seen this with the mink population in Denmark, where they had to kill 17 million minks because of concerns over the spike protein mutation that they felt might have caused the vaccines to be less effective. So this has been occurring. It's only now that kind of the public is focusing on it. And yes, it is concerning, but we shouldn't panic. And here's why. The mutation, in order to evade the vaccines, affects the spike protein of the virus. Now, the body makes a myriad of different antibodies to that spike protein. And the virus can possibly mutate so that one or two of those antibodies, or let's say a monoclonal cocktail of antibodies, will not be effective. But it's not likely that it can mutate that spike protein to evade the myriad of antibodies that the body produces from a vaccine, and at the same time, still have that spike protein able to attach to the ACE2 receptor, which allows it to cause disease. And this is what we see with the measles virus. It mutates all the time, but if it mutates in such a way that evades the vaccine, it no longer is infectious or doesn't cause severe disease. And so this is what we're hoping will happen with the SARS-CoV-2 virus. And in all likelihood, that's going to be the case. Now, if it's not the case, there's a backup plan. The new mRNA vaccines are literally unbelievable. They are printed out using a machine, and the current CEO of BioNTech, he states that if the virus does evade the vaccine, that it would take them approximately 6 weeks to print out and to start distributing another vaccine. This is phenomenal compared to the 5 or 10 years it used to take when they were using eggs and all sorts of different types of materials to cultivate viruses. They've bypassed all of that. They get the genetic code of the spike protein, make the mRNA code, put it in a lipid capsule, and all of a sudden they've got a vaccine. And it literally is a machine that I think is printing out vaccines. I mean, just phenomenal technology. And so that gives us some security, but it's not an excuse to spread the virus, because what we don't want is for the viral mutations and spread to outpace our ability to technologically keep up with vaccines and vaccine production.
So this mRNA, or this technology, so to speak, this is not injecting somebody with a virus like our old vaccines, where this is training your body to fight off the virus. Was that an oversimplification of a more complicated problem?
But it's pretty accurate. It bypasses the cell nucleus, it bypasses making viruses, it bypasses growing viruses. It just takes the messenger RNA, which gets absorbed by the cell, goes directly to the machinery that makes the spike protein, and then the cell presents that spike protein to our immunological response type of cells. And this is very simple. And of course, the simpler it is, the less likely it is to break or cause adverse reactions. And that's another big advantage. Doesn't mean adverse reactions can't happen, but it's less likely. And I have to be honest with you, when you look at the public, they have a very hard time gauging risks. Many people mitigate this viral infection because only 1% of the people die and maybe another percent become chronically disabled. That's not enough to close down or to modify our behavior, but then they'll say at the same time, I'm not going to take this vaccine, or I'm scared of the vaccine because I've heard that 5 or 6 people developed a severe infection out of about close to 1 million vaccines administered, and none of them died, but that still scares me. So people really need to start looking at relative risks. This virus is much more risky and deadlier than the vaccine. So we need to take the vaccine. It's simply a marvel of technology.
I also understand, I'm going to put it in kind of computer talk. I kind of liken it to a chip in a computer, and that they have the ability to be able to go in and tweak it, as you just said, to be able to maybe affect some of the different mutations more quickly than generating a whole brand new vaccine to fix something that's tweakable, maybe. Is that a good way to say it?
Yes, it is tweakable. They just changed the genetic code of the spike protein, and all of a sudden, they can have the body making another spike protein along with the original one, so that you get a immunological response to both. And this immunological response is very specific. It just makes neutralizing antibodies to the spike protein. And that was one of the points that was brought up by the FDA Oversight Committee, and the personnel from Pfizer testified that it's a specific reaction that it elicits, so it's less likely to have other complications such as vaccine-enhanced immunological effects that really are undesired, much less likely to occur with this type of a vaccine.
Dr. Kavanagh, back in March, and I'm not attempting at all to get political here, but back in March and April, it was announced that we would have a vaccine before the end of the year. And there were a lot of naysayers coming out saying that's absolutely not true. The president's lying. The president's making this up, all that sort of thing. And none of us knew for sure whether it was going to happen or it wouldn't happen. But how do you account for the fact that we have been able to do this? Obviously, it has to do with this new technology, but how were we able to generate this so quickly and come out with a product that obviously works? Because look how many people have been vaccinated so far, and I only know of a handful of people that had any kind of a reaction, and nobody has died from it yet, to the best of my knowledge.
It's simply because this pandemic was highly predictable. For almost a decade now, the number one virus which people felt and the scientists felt that would cause a pandemic, and they were very worried about, was the coronavirus. And they have been working on this vaccine for almost a decade along with this technology. There have been scenarios such as the Crimson Contagion scenario, which was played out in November. And this was a federal government kind of war game to predict what would happen during a pandemic. And again, this was centered on the virus. This was highly predictable, was predicted, and people were really geared up and prepared on the scientific community with some basic research and a vaccine development process which was already ongoing. And so basically what they had to do was substitute this spike protein of this specific coronavirus for the one they were studying. Again, it took them weeks, not years, to manufacture this. And if we get a new variant of the virus, same process. It will just take weeks to get a vaccine modification. So this is really exciting technology. It's not using nature to make a vaccine. This is a vaccine which is actually constructed entirely by a machine. And so that is super because we can literally print out new versions of the vaccine.
Without trying to sound like a Pollyanna and saying that maybe this pandemic was in a very, very small way a blessing in disguise, but it alerted us to a situation such as this. The product or the technology was available to deal with it, and we put it to use, and it seems to be working. And maybe this will be the panacea to many new problems that will come up in the foreseeable future and fend off any pandemics. What's wrong with that statement?
And I think that's true, but there are going to be many transformations which will occur because of the pandemic. And many of these are to the betterment. Hopefully we will learn that we're dependent upon one another, we're dependent upon other nations, and that we'll start to work together rather than being concerned of just our individual self, because everybody needs to follow public health advice to protect everyone else. And also the transformations which we're seeing in technology, working from home, and in some respects, even doing some schooling from home, are going to be something that's going to be here to stay. Snow days may become a thing of the past. It may be today you get out your computer and log on because too much snow to go into school. Businesses have found that production and costs are benefited with workers working at home. Production's up, costs are down. People have learned about online ordering. Many people like picking up groceries or having them delivered. These type of changes, I doubt, are going to go away. We've seen a country which has been transformed, and so we're not going to go back to the old normal, but I think we'll go back to a better new normal. So yes, we are undergoing a transformation. I think it is being sped up by the pandemic, but I also think there are some good things which are going to come out of this pandemic. And of course, as you know, there's an awful lot of tragedy which has occurred too, and I don't want to mitigate that. Just saying that there may be some positive things which will be produced.
What is the difference between the Pfizer vaccine, other than the temperature storage component of it, and the Moderna? They seem to be similar. They use basically the same type of structure. Is there any real difference between those two?
There isn't, as far as the patient's concerned, if they're given a vaccine which has been appropriately mixed. And that's the other difference. The Pfizer vaccine requires mixing and reconstitution, as the Moderna vaccine doesn't. So theoretically, there's a little less chance for things to go wrong with the Moderna vaccine. As the Pfizer vaccine, if it's not mixed appropriately, not thawed appropriately, it may not be as effective. Of course, the people are being well trained and it's part of the rollout, so that is very unlikely to happen. But that is another difference between the two. So it's mainly in the mechanisms of having the vaccine reconstituted and distributing. Now, the cold storage is very problematic for some sectors of our nation. So I think that you'll see in the more rural or remote sectors that more of the Moderna vaccine will being distributed, simply because it does not require this ultra cold dry ice storage.
I've received a number of emails from people asking me, does this virus attach itself to like your vegetables and produce that you see in stores? Originally, they thought it did. You had to bring them home and wash them all off and so forth, which we normally do anyway, but that we were more concerned about it, or has that been somewhat mitigated?
I'm not really sure. And the reason is the pandemic has spread so rapidly that case tracking and figuring out where exactly the virus has come from has really become muddied. It's now accepted that the vast majority of the transmission is through aerosols or respiratory, but people still feel that vegetables or fomites, things in the environment, can also transmit the virus. One presentation I heard, they pegged that at maybe 8% of the transmissions. Of course, that doesn't mean you become 8% infected or have only 8% of the COVID.
Right.
If you get infected, you're infected. It's like
Yes.
being pregnant. There's no little bit pregnant. And as you stated, you do it anyways. Take the vegetables home, wash them off. Now, the thing that I do, and this is not FDA approved, I have to tell you this up front, is I tend to wash off most of the vegetables with a soapy solution and then thoroughly rinse it, of course.
Good point.
And that's what I use. Now, soapy solution doesn't mean soap with a bunch of additives and other stuff in it. It's
Right.
just plain soap. Now, I also do not order shredded lettuce. I'll get a head of lettuce. Again, that's going to be safer than have the lettuce that's shredded. Other vegetables you wash off. And of course, if you cook it, it's not a problem. But as you stated, and this is very important, you should be doing this anyways, because there are a number of foodborne pathogens. E. coli, for example, on grown vegetables is a huge problem. And you know, if you just have one or two outbreaks or people getting sick of E. coli, there's massive recalls and restaurants will be closed. Much more stringent than what you're seeing with COVID-19. So you do need to be careful with vegetables. Same thing with handling of meats. And of course, anything that's cooked will rapidly deactivate the virus. And you want to wash your hands thoroughly for at least 20 seconds after handling your food. Again, you should be doing that anyways. You've got E. coli, you've got salmonella, all sorts of different food pathogens. So it just drives me crazy when people say, well, we really have to do that with COVID. You're overstating it. You're an alarmist. No, this is what you should be doing when you handle your food anyways. It's just the way we should be living.
And that makes a lot of sense.
Yeah.
Well, at the risk of sounding a little corny, you remember Smokey Bear, and they used to say, only you can prevent forest fires. Well, I started that by saying, only you can prevent the spread of COVID-19. Now, the point what I try to make to all the people who watch me is, you and I are responsible, you and me, make sure I get the English right here, are responsible for the spread of this COVID. It has nothing to do with the president. It has nothing to do with the governor. It has to do with what we do with our lives when we go out. If we go out, I don't go out because I don't have to go out. I'm very fortunate, but I'm also 79 years old, almost 80. I don't want to get this thing. I'm not going to be with my kids at Christmas, and they only live 20 miles away, but I have 2 grandkids that are in college. They're out and about all the time. I don't want to be near them. You know, maybe they are immune to it. I don't know, but I don't want to be around them. I love them a lot and we can Zoom a lot, but I don't want to spend the time with them because I just don't, and I'm not being selfish. I just think it's the right thing to do. But do you agree that we are more responsible? We're the only ones that are responsible for this thing spreading. If we were more diligent, this wouldn't be happening as bad as it is.
Definitely. We need to take responsibility ourselves. And currently, numerous leaders are voicing that we need to follow public health advice. And this is on both the right and the left. If you look at Republicans, Senator McConnell has made very, very poignant statements that we need to follow advice. We need to take the vaccine. Chris Christie is making videos and ads on wearing masks.
That was a great video he did. I just saw that the other day. It was very humbling.
Definitely. And many of the governors, such as Larry Hogan, Mike DeWine, Charlie Baker, they all have encouraged people to wear masks. And in their states, they've even had mask mandates. Now, of course, that's a legal thing. And my response is it doesn't matter whether it's mandated or not. What you do in court is different than what you do yourself for your community. It's 2 different things. It's our responsibility to follow public health advice. And as a doctor, that's what I want to advocate for.
You know, as a sort of a psychological thing, there was a gentleman that was my partner and mentor, he's long since passed away, but he used to say, you can lead me anywhere, but you can't push me an inch. And I kind of will apply that to what's going on right now. If you tell somebody they can't do something, they're going to want to do it. They don't want to hear about it. Don't tell me I can't do it. I can do it. Don't tell me to wear a mask. I'm not wearing a mask. Somehow we have to convince people that it's a good idea to do it rather than it's mandated to do it. You know, in other words, yeah, would it be a good idea to mandate it? Well, that's kind of tough love. But if you can convince people that this is a really good thing and you should be wearing it, I think it goes a lot further than trying to push somebody to do it.
I agree with you. And this should have been done starting back in February and March of this year. And that's where we really went astray.
But were we learning new lessons at that time? Weren't we all learning from a new book? There wasn't a book written about how to deal with this.
I mean, there wasn't, but let's be honest. We've had SARS, we've had MERS, we've had Ebola. We've had a lot of training prior to this, all of which use masks and social distancing. And for some reason, the CDC came out with, well, we don't have to wear masks. Our group actually reversed that prior to the CDC. And if you can remember the original tweet from the Surgeon General, it said, the public shouldn't wear masks. It doesn't prevent COVID-19. Please save them for the healthcare professional. To me, that was really nonsensical because if it works for the healthcare professionals, it should work for the public. And I think a lot of people started to get mixed messaging at that point. But that's
Operative word is
beside the
mixed
fact.
messaging. Yeah,
Yeah,
that's the operative word right there. People got confused about what they heard, and then they started choosing up sides.
yeah. But you have to look at what's going on in other countries. You have to look at what's going on in the past. And believe me, masks are a key component. Now, when the infection rates are low, some countries, such as Australia, have not used wearing of masks as a critical component. But when they spiked in local regions, Australia was mandating masks. And I should also add that they had a regional approach, but they also closed borders between their states. So yeah, different states could do different things if they were doing better, but if you were doing bad, you couldn't travel to the other states. They were isolating states. It's a very aggressive approach.
Speaking of closing things, would you shut down transportation between UK and the United States right now based on this new strain?
Yes, I would. I would not take a chance. I would err on the side of safety. Of course, this was one of the big talking points, and I think what President Trump did correctly was closing down transportation from China. It just baffles me why we're not applying the same strategy until we know exactly what we're dealing with the new strain in the United Kingdom. I think we need to be very vigilant. We cannot let our healthcare system get overrun, because then we will see fatalities go out the roof. That's going back to the masks. That is when you've got to start thinking about mandates, because you're up against the wall. If the healthcare system gets run over, you're going to see increased fatalities, not only from COVID, but from other diseases, because people don't have access to medical care. So I do think mandates have a place, but I don't think they should be used at the get-go. As you said, convincing the public was important. Unfortunately, we largely flubbed that through mixed messaging.
What is your suggestion now? How can we slow down the current spread of this virus right now? And let's do a couple of different groups. Like first with the younger people. Younger people are different than you and I. We don't have to go out. We can stay home, and that's not a problem. Younger people, well, you got the younger people who are not working or doing anything, and they just get very restless and they got to get out. Then you have the college kids, and they want to do their things. What do we do?
Well, we need to follow public health advice, and we need to do the same thing. The virus doesn't care the type of activity, the type of year, why things are being done. It doesn't care whether it's a protest, whether it's a funeral, whether it's a rally. It doesn't care. If you congregate, it's going to spread. And we right now have close to 3,000 or greater deaths on average. And that's occurring in the United States every single day. So we've got to really sacrifice, at least for a couple of weeks. It will save lives. There's no use having a family gathering and then at the same time be responsible for causing deaths. There are a number of studies which are now showing that gathering with families and gathering in your house is probably one of the most dangerous things you can do, because you're bringing in people from the outside and you're bringing it into a setting where there really is not very good airflow. The air exchanges in the house is much less than what you see in retail establishments or hospitals. And when you have a low amount of air exchange and airflow with an aerosolized or a virus that spreads through the air, it's a setup for disaster. And I think that we're going to see this virus spike again after Christmas, and then unfortunately after New Year's. From what I'm hearing, they're expecting that 25% of the population in the United States will be traveling over Christmas. And to me, that is very, very ill-advised.
85 million people are going to be traveling over this holiday. 85 million people. That's a huge number of people. Obviously, they say, it's okay, I can do it, no problem, I'm not going to get it. And they don't understand. They just can't get it in their head, or we've done a bad job of convincing them that this is not a good idea. It's really our fault.
Well, and that's true. And this is just a setup for disaster, because People think, well, the vaccine's out, so everything is fine. No, vaccines do not prevent disease. It's vaccinations. And not enough people have been vaccinated to even put a dent in this pandemic. So we need to follow advice. And I think the best example I like to use is the snow leopards from the Louisville Zoo. Believe me, snow leopards are very good at enforcing social distancing, not so much at wearing masks. And they caught COVID. So you have to do both. You have to social distance, you have to wear masks. Don't think that just because you gather at a family dinner and you're 6 feet apart, that you're going to be safe. You also have to wear a mask, which, by the way, makes it very hard to be at a family dinner. It's hard to eat and wear a mask at the same time. I mean, if you're eating, you choke, you cough, you're spreading the virus. To me, it's very problematic. This is one Christmas we may have to step back from. Maybe next year we can have 2 Christmases. I'm sure that everybody that's putting off vacation and traveling next year are going to be doing double trips. I mean, we have our whole life to catch up. Let's now watch out for one another and, again, follow public health advice.
Here in Florida, approximately 60% of the people who are passing away are people that are in nursing homes and healthcare facilities in places such as that. And apparently that's a reasonable number. Now, the notion is if we can get those people vaccinated before they catch the COVID-19, this could greatly reduce our number of deaths pretty quickly. And it wouldn't take that much vaccine out there to get rid of those, because that's the biggest group of people that are passing away. And yet it's not that big a group of people that we can't come up with enough vaccine to get to those people. And I think that would greatly reduce our deaths here in Florida.
It would, but one of the things we need to remember is that this virus affects every organ of the body. It's not just deaths, but it's long-term disability. And that's what the young people are running into. Many of the asymptomatic carriers have infections of their heart. It can be asymptomatic type of infections. This was noted in 15 to 30% of athletes in college football. This is problematic because they can have asymptomatic infections and damage that may not present for 10 or 20 years later when their cardiac reserves drop. Remember that patients that have cardiac myopathy or develop that type of heart condition, often decades earlier, had a viral infection that infected their heart that they never knew about. And this is one of the things we're scared about with COVID. And you also, on top of that, have the problems of the long haulers and people that when they exit the hospital, they may have survived, but they haven't recovered. 20% still have lasting health effects that they're battling. So this notion of, if I don't die, everything's fine, so therefore the young people in middle age have nothing to worry about, that's a false narrative. This is a dangerous virus. It infects every organ of the body. It's not like the flu that's a pulmonary virus that usually after a couple of weeks, almost everybody will recover. A few will get very sick, but much less so than with COVID-19.
Well, that's one of the things I say, because as you will recall, there's been a number of cases where these fraternity guys or just people got together and said, well, let's have a party and see who gets COVID-19 first. I mean, believe me, there are people who did stuff like that. And at the end of the day, they don't realize that they think they're just going to get sick and get better and ho, 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 it was a fun party.
Well, definitely. And right now, there's not good reports on how often this long hauler effect occurs. And it's very disturbing because even though we don't know how often it happens, it's being reported in the literature and being reported online by individuals extremely frequently. So frequently that people need to be concerned about it. So again, do not get the virus. And I should add, this long hauler effect and scenario is occurring commonly in younger individuals.
That's long hauler. I did not know what that word was, and now I have to file that one away. When do you think we are going to be back to normal? Now, most obviously, it has to do with the vaccine getting out. And I mean, this is really a crystal ball answer, but what's your estimation? I've heard everything from the end of next year to maybe around summertime and then as early as springtime?
A lot of that's going to depend upon the public of whether or not they're going to adopt public health strategies and embrace the vaccine. And I do think we're going to be a new normal. I think people are still going to have to be cautious on spreading infectious disease and during certain periods of the time wearing masks. But it's really up to the public. So it's hard to answer that question. If we have 50% of the population not taking the vaccine, it's going to be an extremely long time, because you need to remember this virus is also in the animal population right now. We've talked about snow leopards. It's also in cats, dogs, minks. So all of this is problematic, and the virus can reemerge if people aren't careful and they're not adopting public health strategies. If you put on top of that, people aren't taking the vaccine, well, then who knows? Because it's also a setup for the virus to have a significant mutation. The more they spread it around, the more likely the unlikely event that this virus mutates for it to avoid a vaccine can occur. And even though, as I said, Moderna can quickly crank out another vaccine, it means revaccinating everybody in the whole world all over again. And that's not a small task. So again, follow public health advice.
This is a little bit of an iffy question because it sort of borders on the line of political, and I'm not being political when I say it, but it seems to me like you can't fly in an airplane unless you have an ID card. You have to have an ID card. Nobody complains about that. That's perfectly okay. People are concerned right now. Well, I don't want to give any of my information out when I get the shot. You know, I don't want to do that. I don't want anybody to know about me. It seems to me like we should be given some kind of a card or some form of documentation to say that we did receive the vaccine, or we should have some little document that said we were COVID-free at such and such a date. More so with the vaccine, because I would want to go into a restaurant if I knew that everyone in that restaurant had had the vaccine. I would be happier to go there than not.
That is sort of being done because everybody's going to get a card when they get the first dose to make sure that they get the second dose on time,
right,
and from the same manufacturer.
Right.
You can't mix the Moderna and the Pfizer vaccine. That's one of the scenarios people are very concerned about. You get the first dose of one, the second dose of the other. Who knows what's going to happen?
Of course.
But the reason why right now the cards have not been advocated for is we're really not sure if when you get the vaccine, you are going to be immune from getting an infection or just immune from getting the symptoms. In other words, you'll get a mild infection and still spread the virus, in which case you're really no better off to other people than someone who has symptoms or who didn't get the vaccine. That's just not known. What is known is that if you get the vaccine, you have a 95% chance of not displaying the symptoms of COVID-19, and that if you do get sick, you probably are not going to get severely ill. So right now, whether or not you have a vaccination card for giving you special privileges in society, that's probably not right now on the planning books. May someday, but you will get a card because, again, you have to know when to take your second dose and what that dose is. So you'll be able to show it to someone to let them know that, hey, you've received the vaccine.
I'm remembering the time when I was in the service and when I was traveling a lot in Central and South America, I had to bring a vaccination card with me in order to get into the country, because they obviously believed if you had been vaccinated for these various things, you would be less susceptible to bringing that disease into the country. What's it going to take for us to get to that point where we will feel pretty confident that once we've had the vaccine, that we aren't going to pick it up again and retransmit it?
They're just going to have to follow patients who have had the vaccine for a number of months.
Just more
That's
time.
One of the unanswered questions.
Yeah, just more
time. Yeah. And that's going to be important to do. And I think that also when you look at medical records and having a universal ID number and sharing of records, that's going to be a discussion of whether or not we should be doing that, because you're going to want to know if people develop an infection. People are going to want to know that if you have a test and then you get another test, that you're not counted as a duplicate positive. It would take care of so many problems with epidemiological tracking and estimation and estimating the extent of the disease. And many of the questions that the legislators are complaining about can't be answered because we don't have a unified medical record or tracking of individuals. In some countries, they have that. And so that you know very specifically, one person, 5 tests, or one person and 2 diagnoses, you know it's coming from one individual. As currently in our system, if you go to health system A, then go to health system B, you get positive tests. That might be counted as 2 tests. They do try to take out duplicates, but it's an enormous amount of time. And of course, there will be some errors that occur. And it's wasted time that could be spent on directly addressing the pandemic.
Is there a country in your mind that has dealt with this pandemic better than any other country?
I think you look at South Korea, Taiwan, Australia, and New Zealand, and of course, China. They all have dealt with this pandemic better than we have. Now, in all fairness, all of those countries were exposed to SARS, which gave them a firsthand experience of what we're up against. Because I can tell you, if we get out of this and by chance we get another pandemic from a different coronavirus, we probably aren't going to have as big a resistance to public health measures as what we had with this virus. We won't have this discussion on whether to wear masks. I mean, if you went to Southeast Asia, they just put masks on. Singapore had in their stockpile enough for almost 3 masks, N95 masks for every citizen. We had a paltry sum of masks, very, very small, in our national reserves. And so this is something that's going to be a learning lesson from our nation. It's unfortunate that we have to learn this ourselves. We should have learned this from experience of other nations in the past.
Okay, Dr. Kavanagh, in closing, I'm going to ask you to give us a couple of parting remarks. I'll let everybody know if they would like to find out more about you. You can go to healthwatchusa.org, healthwatchusa.org. And I appreciate you very much being with us. Got any parting remarks for us, words of wisdom, so we can live with those for the next few months and get through this?
I think that's exactly it. We only have a few months to live with this pandemic. Let's hold on. Let's buckle down. Let's do some sacrifices until everybody can get a vaccine. It's not only important for you, but it's important for others and for your neighbors. And so if you have to give up Christmas, if you have to give up New Year's, that may be a good sacrifice. The other thing that you can do is change the way you celebrate Christmas and New Year's. Have your dinners over Zoom. Start to play with your grandkids online and do things differently to make it a little bit easier to just last a few months. Because in this case, if you flatten the curve, you're definitely going to save lives. You're not prolonging the inevitable. You're going to save lives. And that's what we need to be doing.
Good job, Dr. Kavanagh. I look forward to talking to you again. Ron Crider signing off for today. Thanks for watching.
Thank you very much, Ron.